Hello. Welcome to the Massachusetts General Hospital From Care to Cure 2021 Educational Webinar Series. My name is Katie Brandt. I'm the Director of Caregiver Support Services and Public Relations for the MGH FTD unit, and I will be your presenter today. My presentation, Person-Centered Care Planning, will focus on building a plan for your life, living with a diagnosis of dementia and beyond. So my goals today are that I will provide you with information about the resources offered through the MGH FTD unit, that I'll walk you through what does person-centered care planning look like, and I'll give an example of what that care in action might be. So part of my role in the MGH FTD unit is to coordinate educational opportunities, content, resources. And it's been so wonderful to hear from our community of persons living with a diagnosis, caregivers, and professionals about what you guys really need. We've been working on our website. We have a newsletter. We have a YouTube channel where you can find all of these educational webinars and any spotlight events, our Community Forum Fridays. And we're also affiliated with the Association for Frontotemporal Degeneration Support Group. So I'm an AFTD support group leader, along with my colleagues, Amy Almeida, Amy Marchesano, and Bernie Metzger. And we are all proud to be connected with this resilient community of care partners, walking the journey with them, living life, caring for someone they love who's living with a diagnosis of Alzheimer's disease, FTD, or a related condition. So if you want to know how to get connected with us, send us an email at mghftdunit@mgh.harvard.edu. Check out our website, ftdboston.org, or go to our YouTube channel. Type in MGH FTD unit in the YouTube search function, or use the URL below. These are ways that we want to try to make it easier to connect with our community. It is true that the pandemic has provided the opportunity for us to have connections online in a way that we never have before. But what we've really heard from our community is that these resources, the access to online supports, is necessary. Life is challenging, and sometimes hiring someone to be in your home, to be with your loved one, traveling a great distance, fighting traffic, it's all a big barrier to getting support. So we're proud that we're able to offer these online resources to make it easier for you. So as I begin my talk today, as I often do at the From Care to Cure spring educational sessions, I like to talk about how I myself am connected with the community. I have my own origin story as a caregiver, loving someone who was diagnosed with frontotemporal degeneration. This is a picture of my husband, Mike, and I on our wedding day. And in this moment, we had no idea what was coming ahead. We were planning for graduate degrees and what was our next car going to be? How are we going to decorate our apartment? Who do we have over for dinner on Friday night? We weren't planning that he would have a diagnosis of behavioral variant FTD at the age of 29. Even though this is an unplanned journey, I've learned a lot along the way. I've learned that love is stronger than dementia. My experience being a caregiver, loving and losing Mike in 2012 has empowered me to want to do more for our community. I had to do something with the energy that my grief created. And one of the things that I thought a lot about was access to resources and supports. Even if we don't have a cure today, for Alzheimer's disease, FTD, or related dementias, we have a cure right now for the isolation and loneliness that can be caused by these conditions. So I want to use my authentic voice. For almost 6 years now, I've been a member of the clinical research team in the MGH FTD unit, and I'm incredibly proud to be the director of caregiver support services and public relations, to have the opportunity to connect with families throughout every stage of their journey, to be able to speak on behalf of our community. I have the honor of sitting as co-chair on the National Alzheimer's Project Act Advisory Council for Alzheimer's Research, Care, and Services. That's the NAPA Council. And this council was created to support the National Alzheimer's Plan. Many of you may remember when President Obama said that we needed to have a commitment to cure Alzheimer's disease and related dementias by 2025. And that developed the National Alzheimer's Plan. The council is there to make sure that the plan is moving forward to get us closer to treatment and a cure. We may not have achieved all of our goals by 2025, but that robust commitment to being aspirational, to having the goal that we all really want in mind, is what has moved us forward to raising more funds, awareness, and hope that the cure of tomorrow is not so far from the care of today. I've also been the co-facilitator of the Boston area FTD support group for almost 10 years. We should probably give out some, medals for people who attend so many support groups. But as much as the stories along the way, my own stories, when I was a caregiver walking the journey, were difficult, I found so much solace, camaraderie in being with others who understood what I was going through. And so that's why I wanted to talk to all of you today about person-centered care planning. One of the things that many families and I experience is that the moment of diagnosis does not come with a manual. Many folks report that when they received their diagnosis of FTD or Alzheimer's, that they walked out of their doctor's office and they didn't know what to do next. Some of you may have heard the term person-centered care planning or care planning, but not actually known, what does that mean? What does that look like? So I want to say that a care plan can be what you want it to be. It can be unique to your needs, your values, your goals of care, your culture, your family. But I'm going to give you a framework today to help you think about how you might set up a person-centered care plan that meets your needs and your goals of care. So if you look at this diagram, you'll see that the circle in the center has the person living with a diagnosis and the care partner. So that could be, a care partner could be a family member, a friend, a spouse. It could even be someone who's a part of a professional healthcare team. But the idea is that the needs, wants, values, and concerns of the person living with the diagnosis and their primary care partner are valued and addressed in every aspect of the care plan. I think of the care plan in 3 domains: the medical community, the disease community, and the home community. And I'm going to walk through each one of those now to talk to you about what that looks like. So when you're starting your care planning, you need to think about, who is your medical team? What is your connection to a medical community? This is critical. It's incredibly important that you're with healthcare providers that understand your specific diagnosis. So, for example, if you have a primary care physician that tells you that they haven't cared for any patients that are living with frontal temporal dementia, you may find that it's difficult to talk about medications, symptoms, behavioral challenges, and you may find that in your appointments, you're spending a lot of time explaining the condition. This could become tiresome over time. It could even cause conflict in making sure that your goals of care are met. So you want to talk openly about what your goals are and if your current healthcare team has the expertise to meet your needs and support you with your specific diagnosis. A connection with the right medical community, the right care team, can give you more treatment options, can provide you with the right education. We want to help people avoid that midnight Google. Of course, it's important to read about your diagnosis, to try to plan and learn about what may come ahead. But what we want is for you to know that there are trusted information sources. So, for example, if you're living with primary progressive aphasia, a great place to get information is through the Association for FTD. Actually, every year they have an amazing educational conference, and it's a great opportunity to get information from a trusted source along with your medical team. You really want to think of it as a partnership for care management. You may have opportunities to participate in research. And again, this is connected with getting the right diagnosis. So, is your cognitive impairment caused by Alzheimer's disease? Is it caused by FTD? What is the condition causing your symptoms and challenges? This could affect what research you're eligible to participate in and what treatment options are right for you. And then the interdisciplinary approach is critically important because with conditions like these, one healthcare provider is not going to be able to manage everything. So, who would be members of your medical team? Your primary care physician, your neurologist, a neuropsychologist potentially, a psychiatrist, speech and language pathologist, physical therapist, occupational therapist, a social worker, and a mental health clinician could all be members of your medical team. You want everyone to know about your diagnosis and have the ability to connect and work together. Just thinking about medication management, it's incredibly important when you can make one healthcare provider the go-to person for all medications, but that they can communicate with your other providers about what prescriptions they're assigning to you. So a connection with the disease community. This is a place where you can find support groups, again, disease-specific education, advocacy opportunities, and even patient registries. I want everyone to know that the Alzheimer's Association's official name is the Alzheimer's and Related Dementia Association. Now, that was a little bit too long for folks to remember, but what's important about that is that anyone who's living with dementia, that's a dementia caused by Alzheimer's disease, Lewy body, frontal temporal degeneration, has the ability to access services and supports from the Alzheimer's Association. They have a 24/7 hotline, and all of the services and supports that they provide to families are free of charge. So if you live in an area where you're having trouble connecting with an AFTD support group, but you still want to be able to get those services and supports, that connection with families who live local to you, reach out to your Alzheimer's Association. One of the things that the pandemic has presented is so many more online support groups and online educational opportunities. So that has really opened up the opportunity to connect with people who are experiencing what you're going through. Maybe you want to attend a support group that's for spouses or for adult children. Maybe you want to be in a group that's for young onset dementias or those that are experiencing dementia later in life. I would encourage you to connect with the advocacy organization related to your disease so that you can get individualized support based on your diagnosis. Feel that camaraderie, feel that connection. This is a picture of a fundraiser event that I had at my home, I think in 2014. And for me, it's just really emblematic of that connection with the home community. Care does not always happen in the clinic. So, what you need is that medical home base. And then you need to be able to take that information home and get the supports that can help you live your day to day life. So, a connection with your home community would also include your connection with an elder law attorney to help you manage legal issues related to your diagnosis, maybe a financial planner to help you make a new plan for the road ahead. It could be a connection with your senior center, an adult day health program, a memory care assisted living facility, or a skilled nursing facility. You may find that there is a neighbor who wants to offer companion support or a home health agency that can help you take those breaks when you need them if you're caring for someone living with dementia. So when you think about the care plan summary, what you really want to remember is that you want to make connections in the medical community, your disease community, and your home community. And you want to think about doing three things. You want to identify what is your diagnosis? What are the needs that you're going to have? What are the hopes that you have? And what are your goals for your future care? You want to protect. You want to address legal and financial issues. You want to address whatever issues may come up related to employment. You want to even protect yourself. You might think about, geez, I really need to think about stopping driving, or we might need to hire someone to spend time with you so that you're not alone if you're a person living with a diagnosis. And then lastly, you want to build, engage with local providers, build your team. It's this idea of having a deep bench, and not every member of the team has to do the same thing. Somebody might be really happy to mow your lawn for you every week. Another person might make you a lasagna the first Friday of every month. Somebody else might come over and have coffee with your loved one so that you can do the grocery shopping. It's about figuring out what are the resources available to you in your local community, and what are the resources available to you online so that you can get the help and support you need. So that's thinking about the person-centered care plan in the larger sense. That's great, but you got to get up in the morning and live every day, one day at a time. That's what we're all doing. So I really wanted to think about asking the questions, how does our care plan transfer to our everyday life? How are my values reflected in my care plan? And what does personhood and dignity look like at every stage? What does a care plan in action look like every day? How can you get up in the morning and apply that larger person-centered care plan to your daily routine? I'm going to walk through an example of navigating dealing with a challenging behavioral symptom, such as perseverative behavior. And we're going to talk about that in the context of a daily care plan that will include the three domains: medical, behavioral, and environmental. And this is an example of using your care plan in a more specific, smaller way to navigate life from day to day. Okay, so let's think about the example. Imagine that one of the symptoms that your loved one with behavioral variant FTD is experiencing is persistent compulsive behaviors. So a persistent compulsive behavior might be biting all of their fingernails constantly. It could be pacing around the house. It could be humming loudly and relentlessly. It's often found that symptoms such as these can be incredibly challenging for care partners to navigate. we do think that these types of behaviors are not particularly upsetting to individuals living with a diagnosis, but we want to help the dyad of the person living with the diagnosis and the care partner to exist in harmony as much as possible. So, if your loved one is experiencing a challenging, persistent behavior, the first domain you would want to consider is medical. Medical means that you would want to make sure that your loved one is not experiencing any illness or injury related to the behavior. That might mean that you need to connect with their primary care physician and request blood work or a urine test to look for a urinary tract infection. You would want to make sure they're not experiencing a fever or other cold or flu-like symptoms. Anything that might cause them pain, such as pain related to an oral cavity or abscess, anything that could cause them pain could be disruptive and could cause an exacerbation of symptoms. In the medical domain, you can also consider the physical state of your loved one. So thinking about, are they hungry, thirsty, constipated, overtired, fatigued? And this can also give you a clue about how symptoms might ebb and flow throughout the day. Medication management is a critical part of the medical domain. This is where you would want to coordinate with your medical team, your expert healthcare provider, to talk about, are there medications that should be considered to help to dampen or extinguish this challenging symptom? When you move on from the medical domain, you want to think about behavior. Behavior is all about your response to whatever symptom is presented by your loved one and your approach to your loved one as well. So responses, let's say your loved one went in and unstacked all the dirty dishes and put them away in all the cabinets and drawers. And you walk into the kitchen and you realize that those spaghetti covered plates are now inside your kitchen cabinets. To be able to respond calmly and peacefully can help to promote a calm environment for you and your loved one. And it takes practice. It's challenging. In order to do this effectively, it can help to attend support groups, to go to educational sessions, to get more tips from other caregivers. It may even help to have respite and mental health support for yourself built into your day, so that when those challenging situations arise, you have taken the time to put the gas in your tank so that you're able to manage that situation. When I think about approach, I think a lot about facial expression, body language, tone of voice. Dr. Paul Rea was the creator of habilitation therapy, this amazing model for dementia care that the Alzheimer's Association uses. And he talked a lot about spending 5 to save 20. So what that means is, let's say it's time to help your loved one take their shower. So instead of walking up to them and saying, come on, it's time to get in the shower, we've got to get going, we have a busy day, you might sit down next to your loved one, look at them, smile, talk to them a little bit about your morning or your day, how have things been going, have a soft tone of voice, and approach this topic of bathing and personal care with ease and a non-rushed approach. This can help your loved one to have good feelings. Another thing that Dr. Rea talks about, feelings first. The behavioral approach is all about eliciting positive feelings, feelings of calm, safety, reward, love, so that you and your loved one can go about your day as easily as possible. Environmental. So we have the 5 S's that you can try to think about. sights, sounds, smells, schedule, and sensations. So just think about your environment, the environment that you and your loved one are in every day. Try to identify, are there any patterns to the symptoms that are challenging? Looking around, what do you see? Are the images on the TV ones of crime and war and challenging events on the news? Or is it the Nature Channel that's highlighting beautiful birds? Thinking about, what does your loved one find interesting, calming? This is a way to try to incorporate values and the unique preferences that you and your loved one have in your care plan. The environmental approach is all about what works best for you. I worked with one individual living with a diagnosis who really loved cats. And so she subscribed to Cat Fancy magazine, and it made her happy to have many issues of the magazine in every room in her home, so that at any time that she was feeling stressed, she could stop and look at the cat magazine. It was something in her environment that she could reach for to bring a smile to her face and make her feel happy and relaxed at any given moment. The schedule is also something that you want to think about as a part of the environmental domain. And for many individuals living with cognitive impairment, schedule and a routine schedule is critically important. This can also be an opportunity to notice when symptoms are most challenging. That information is critical to share with your medical team when you're thinking about medication management. One thing that we cannot forget is the importance of self-care when we're talking about person-centered care planning. The person at the center of the care plan is both members of the dyad. It is the person living with the diagnosis and the care partner. There is data that being an Alzheimer's or a related dementia caregiver can be a threat to your health. We know that Alzheimer's caregivers have higher healthcare costs than non-caregivers. We know that more caregivers of people with depression, of people with dementia, suffer from depression. And we know that many caregivers report they're concerned or very concerned about their own health. Caregivers may put off their own well visits or delay going to the doctor because they're so focused on caring for the person they love. And what we want to do is encourage you to make your own self-care a part of your person-centered care plan. All of these things need to work together. If you really focused a lot on just one domain, it probably wouldn't be enough to help you navigate the journey of dementia and have new moments of joy. This is a picture of my dad, who is living with Alzheimer's in a memory care assisted living, and my son, Noah. This was their first hug in COVID after, I think it was 8 months. So when we think about all the different domains that go into a person-centered care plan, at the heart of it are our values. Who do we love? What's important to us? What gives our lives meaning? I think that COVID has showed us that social isolation creates incredible challenges, not only for people living with a diagnosis, but also for care partners. We've seen an increase in cognitive declines. We know that individuals living with dementia themselves have an increased risk of catching COVID-19 and having more significant symptoms. And we have also seen the importance of resilience. This quote was shared with me by a trusted colleague and local expert, Jennifer Pilcher. She's a wonderful life care manager that's helped many people in our community. And she shared it with me because we were talking about the challenges of social isolation. I myself have felt the burden of being socially isolated, not able to connect with my dad in the way that I used to, not able to connect with the caregivers and the families that I work with each week in the same way that I used to, not able to offer that hug. And this definition about the impact of social isolation came from Brigham and Young University. Just like hunger signals us to eat and thirst signals us to drink water, loneliness is thought to be a biological drive that motivates us to reconnect. Throughout human history, we've relied on others for survival, and proximity to others, particularly trusted others, signals safety. So when we lack proximity to trusted others, our brain and body may respond with a state of heightened alert. This can result in increased blood pressure, stress hormones, and inflammatory responses, which, if experienced on a chronic basis, can put us at increased risk for a variety of chronic illnesses. I shared this definition with you to validate the challenges that we're all experiencing, to say that there's a real scientific reason for the way that we're all feeling when we're separated, but also to point out that there's an opportunity to mitigate these negative impacts of social isolation. As my co-facilitator, Amy Almeida, aptly pointed out at our most recent online caregiver support group, look at how we are all fighting against the negative impacts of social isolation by coming together as a community online. We may be together in an online platform, but the connections, the love, and support that we're sharing with one another are real. And so I would encourage all of you, if you're feeling disconnected, reach out, make an online connection now. And when it's safe, we'll be able to turn those connections into in-person ones when it's right for you. And if it's part of your values of your person-centered care plan. As I close out today, I want to share with you this picture of my son, Noah. We talk a lot about origin stories and superheroes. I mentioned to you at the beginning of my talk that it was my origin story of falling in love with my husband and being his care partner that brought me to your community. If you think about origin stories for superheroes, they're always based in trauma. It's a negative experience, an experience of loss or violence that creates the opportunity to identify skills, powers, and resilience that they never knew they had. Superheroes have a nemesis. For many of us, that nemesis is FTD, Alzheimer's disease, or a related condition. And they also have weaknesses. They need the support of their friends and families. Batman needs Robin. So in anticipation of a presentation that I did a few years ago, I asked my son Noah to put on his Batman costume, and we went out and took pictures at a local park. And towards the end of our impromptu photo session, Noah took off his mask. He grabbed the big orange ball that we brought, and he was just running around having a great time. And I was really struck by the idea that even superheroes need a break. Think about Superman living as Clark Kent. No one can live as a superhero every day, all the time. And so for every care partner who's hearing this presentation today, I want to encourage you to work with your loved one and your medical team to develop a care plan that includes respite for you, that includes times where you're connecting with folks who tell you it's okay to take off your cape. It's okay to need support. We can see how resilient you are We can see that you are navigating unspeakable challenges, and our community is working to develop treatments and one day a cure that will make those challenges easier. But today, we need to connect and have the support to make it to tomorrow. I want to thank you all from the bottom of my heart, not just for being a part of today's session, but for everything that you've all done to help connect with our community throughout this past year and beyond. It has been so meaningful to be able to continue our work, providing you with treatment, care, and support, to continue our research efforts, to know that the policy initiatives that we're working on are moving forward. Being able to connect with each one of you has been an inspiration and an honor. Thank you so much for your time and attention today. I hope that you will all be safe and well.